Good morning. Welcome to the next event in our almost 20 years of Longwoods Breakfast. I am excited to have everybody here with us this morning. Today's event promises to be a good one. Over the last 18 months or so, I have been following Neil Fraser and Medtronic, and they have made some wonderful corporate gestures in support of the health systems in Canada, the US, and more. Big kudos to them. Before we get started, for those of you who have not had the opportunity to meet me before, I am Matthew Hart, CEO for Longwoods and producers of these events. I am a strong believer in building your network, so please feel free to reach out to me at any time. LinkedIn is one of the easiest ways to do that. I would also like to remind everybody that if you have questions, please ask them using the Q&A function on your screen. If you put questions in the chat, a good chance we might miss them. Lastly, I would like to thank Graham Wilkes from the Healthcare Excellence Canada and Michael Kahn from Workday for supporting today's event. These events would not be possible without the support from them. As with me, please feel free to reach out and introduce yourself to them. To moderate today's event is another person I'm a big fan of. I would like to turn things now over to Sarah Downey, the President and CEO for Michael Garron Hospital in Toronto. Sarah, the floor is yours.
Thank you, Matt, and good morning, everyone. What an exciting day this is. I'm delighted to welcome one of global healthcare's most driven and innovative executives, Geoff Martha. As chairman and CEO of Medtronic, Geoff leads the $30 billion company and its 90,000 employees in pursuit of fulfilling Medtronic's mission, which is to use technology to improve human welfare. Under Geoff's leadership, Medtronic is putting the tech in med tech, leveraging the latest advances in technology to transform healthcare, including robotics, machine learning, and artificial intelligence. Geoff became CEO in April 2020, in the very early days of the COVID-19 pandemic, and has been with the company since 2011. He notably led the acquisition and integration of Covidien, the largest acquisition in the medical technology industry. But before I pass it over to Geoff, I'd also like to introduce his colleague and someone who is no stranger to the healthcare system, Neil Fraser. Neil is the president of Medtronic Canada. He's a member of the Federal Health and Biosciences Economic Strategy Table and was a member of both the Federal Advisory Panel on Healthcare Innovation, often referred to as the Naylor Table and Report, and the Ontario Health Innovation Council. He has numerous publications on the topic of healthcare innovation, and this week launched his podcast series called The Next 100, which celebrates the 100th anniversary of the discovery of insulin by discussing the next 100 years of health innovation with Canadian luminaries. We will chat with Medtronic leaders in the Q&A session shortly, but for now, I'll pass it over to Geoff. Over to you.
All right. Well, thank you, Sarah, and hello, everybody. Appreciate the kind introduction, and thank you for moderating the session today. Looking forward to the dialogue here. I've been asked to talk a little bit about some of the lessons learned over the pandemic, and so I dive into that, and I want to make sure we save time. I know you have the Q&A afterwards, Sarah, that Sarah will be moderating with Neil and I. So I look forward to that. So, as Sarah said, I'm Geoff Martha, Medtronic Chairman and CEO. I've been in the role for about 18 months and started just right after the World Health Organization declared COVID-19 a global pandemic. So it was an interesting time to take over this company. It's been a challenging time, but it's also been a very exciting time to see how Medtronic and other industry players can help solve complex healthcare challenges in new ways. Innovation and collaboration are more important than ever. And complex and chronic diseases are, they're on the rise. They may have taken a bit of a backseat during COVID-19, but they've actually been compounded by COVID-19 as these elective cases have been deferred. At the same time, disparities in access, cannot, have gotten worse and have been highlighted and need to be addressed in creative, but also sustainable ways across healthcare systems. I'd say also healthcare technology is advancing and evolving rapidly, and remote care options, artificial intelligence, and virtual training and support can all help solve some of the issues I just mentioned. And look, Medtronic is in the middle of this. We're at the nexus of healthcare and technology at a time that couldn't be more important and more excited. And I'm excited to share what we're doing to advance innovation and produce better outcomes. Today, I thought I'd provide a brief background on Medtronic. I know many of you know about us, but I just want to make sure a brief background on Medtronic and our mission, which is to contribute to human welfare, and review some of our key products and therapies, and share some examples of how we've been, using the power of healthcare technology and our incredible global team to create new partnerships and serve customers and patients during the pandemic. And like I said, following this, we have the dialogue, which I'm looking forward to, the open Q&A, and Neil Fraser will be joining me for that, who, as you know, is president of our Medtronic Canada. So you see here on this slide, this is our mission. And to understand Medtronic, you have to understand the most important part, which is our mission. We're a technology company that likes to push the limits of innovation and challenge ourselves to create high quality therapies that lean right into some of healthcare's most difficult challenges and improve people's lives. And now for 6 decades, the Medtronic mission has remained the same. We haven't changed a word of it, to invent and develop technology, which is to alleviate pain, restore health, and extend life for people all around the world. And the words of our mission are as relevant today as they were when it was written, 6 decades ago. And as you look at this, if you look at like Tenet 5 here, or the personal worth of employees, Tenet 6, talks about good citizenship. These were not, today, these are common terms, but back in 1960, most organizations, particularly for-profit companies, were not talking about these, and this is something it's really part of our DNA. So if you move on to the next slide here, a little bit about the history. We started as a pacemaker company, but through the years of innovation and collaboration, we vastly expanded our footprint and our capabilities. Today, we create innovations at the therapeutic, procedural, and at the system level that treat more than 70 conditions in the human body. And our technologies improved the lives of more than 72 million people last year alone. That equates to, if you do the math, 2 patients every second. And while that may sound like a lot, there are still so many patients who could be benefiting from our therapies who do not, which we'll talk about today. And you have my commitment that we are working hard and will continue to work hard to expand our reach to many more patients in the future. And we'll talk about how technology is the key to doing that. If we advance to the next slide here, our one change we recently made to help accelerate our innovation is our structure. You see here on this page, we reorganized the company into 20 operating units. Each of them are focused on a specific condition or maybe a narrow set of conditions. And this narrow focus is enabling our businesses to be more nimble, act with speed, and get closer to our customers and the patients that they serve. And this is important because in the med tech space, there's lots of technologies and there's lots of startups that are well funded, and innovation is moving quickly. So we had to make sure our structure enabled speed and empowerment, and our culture is talking about decisiveness here and moving and being bold. So this structure amplifies our ability to accelerate the innovation as well as collaboration with our customers and other industry players in ways that 18 months ago we really couldn't do. And we didn't change, though. The one thing we didn't change is our commitment to our patients, and like I said, the Medtronic mission. It's stayed the same for 60 years, and I anticipate it'll continue on for another 60 plus. If we go to the next page, I'll shift gears here and talk about some of the lessons learned and actions we took during the pandemic. What you see up here is our guiding principles as we entered the pandemic of, making sure that we were able to fulfill our mission and getting our products to our customers and healthcare partners, and acting responsibly in our communities, mitigating the spread of the disease. And because even though our factories were open, we made sure that and running at full speed, we were making sure that these are safe places and not a place where the COVID-19 spread, and protecting the health and well-being of our employees and their families. These are the guiding principles. And it really helped guide us along with our mission, through the pandemic. And over the last 18 months, I'd have to say, I've learned a lot and had to make a lot of decisions in a pretty quick period of time, and especially being new. And look, these guiding principles and our mission really made those decisions a lot easier. And I know it's become a bit cliche at this point about COVID changing everything. But it did change a lot for us, including the way we innovate and the way we work with partners that, frankly, we didn't even really imagine as we, going in before this pandemic. The pandemic presented the world, with an unprecedented challenge, which required an unprecedented response, including, like many of you and our team at Medtronic. And I'm extremely proud of the way our employees have risen to the occasion and jumped in to help healthcare workers, governments, and NGOs around the world, and for the way they've continued to support their communities and their families as well. We've been at the service of medical professionals and healthcare systems around the world throughout this whole pandemic, and continue to do that. And we've developed and rapidly deployed new remote procedure support and monitoring solutions, which I'll show you in a second, to reduce patients' and clinicians' exposure to the virus. And during this time of need, we also, have been supporting our communities, as it says here on the slide. The Medtronic Foundation has pledged more than $50 million in monetary and product donations to nearly 50 diverse BIPOC-led organizations, so they can invest in their community responses. If we shift to the next page, we'll get into some of these more specific lessons learned. I'd like to take some time to walk you through a few examples of how the pandemic really pushed us to rapidly innovate and creatively collaborate to better provide care for people who needed it, no matter where they were located around the world. One example that I think many of you might be familiar with, the acute need for ventilators as life-saving devices and the management of COVID-19 essentially happened overnight. I still remember it was in New York City where this whole run on ventilators started, especially when the governor at the time of New York, Governor Cuomo, and Michael Dowling, who is the CEO of a large health system in New York City, said they needed about 500,000 ventilators just for New York City. That created effectively a run on the bank, a run on ventilators. We had everyone from around the world calling us, asking for more ventilators. Then the next day they will call back and demand more ventilators. And we're roughly, almost a third of the world's critical care ventilators. And pre-pandemic, we supplied one of our ventilator lines, the PV560, like the one shown here, to 35 countries around the world. But during the pandemic, governments were threatening to shut down borders to prevent ventilators from moving across country boundaries. And the demand far outstripped the supply of not only Medtronic, but all ventilator manufacturers. It was by a lot. So we were forced, we were trying to think creatively. And so we decided to make this ventilator that you see here on the bottom right. We decided to make these specs available online and open source, so others could help us innovate and solve some of our problems in scaling and some of the obstacles, but also manufacture ventilators during the pandemic. It was clear that early on that we couldn't do this on our own, no one company, no one entity, and we needed some help. So, we thought open sourcing would be a great way to, see what help is out there. And through all this, we increased our internal production of ventilators fivefold from prior to the pandemic. So in a very short period of time, we ramped up our ventilator production, our internal ventilator production 5 times. In addition to that, created some additional capacity on top of that by partnering with different organizations around the world, one of which is in Canada. So some of the partnerships I'll highlight, one with SpaceX. So one of the biggest challenges, like I said, of scaling these ventilators is the supply chain. These ventilators have a lot of parts from a lot of different suppliers and across many different countries, and some of these parts are in short supply. And SpaceX, Elon Musk helped us, with one component part that they happen to make for their spacecraft. It's a valve that moves the gas around. And just if you think about it, a ventilator is a life support system, and you need life support systems in space as well. So that was an interesting partnership. Intel helped us with some, a more powerful computer chip that we were able to put in there and work, and the software around that enabled us to remotely control the ventilators from outside of the ICU. So if healthcare workers didn't have to go inside the ICU with the aerosolized COVID, we also put all of our not just ours, but all of our competitors' operating manuals, user manuals into one application. We formed a ventilator training alliance, so that healthcare workers around the world that were dealing with a lot of new ventilators could go to one source if they had questions on how to use it. So those are just some of the things in ventilators. If you shift to the next slide here, it talks about some monitoring, some makeshift ICUs we created with healthcare partners, in this one in New York City. So as you know, New York City was hit pretty hard. They have almost 9 million residents, and their infrastructure couldn't handle all the COVID patients. And so the healthcare workers needed a way to remotely monitor vital signs of patients admitted. And we created a stand-up mass ICU in a large convention center called the Javits Center. And we quickly installed several technologies to create a system that allowed clinicians to remotely monitor all these patients in this Javits Center Convention Center in New York. And we set up an operation like this normally takes weeks or longer. We were able to do it over a weekend. Remote technology was vital to this whole thing, and vital to fighting the pandemic. And it's another example how we use technology to partner with hospitals to combat the pandemic. In this case, our technology allowed 10 clinicians to monitor over 400 patients in this makeshift ICU. And based on the lessons learned in this example, Medtronic has been partnering with hospitals and health ministries around the world to implement solutions like this, especially at the height of the pandemic, more broadly. And then as we face further healthcare crises, I think this is a model that can be leveraged. If we switch to the next page here, another example of how we came across certain capacity constraints. Capacity constraints for non-COVID patients was another huge issue for health systems, and during the pandemic. And in many cases, in many cases, screenings, procedures, and surgeries continued to be postponed, as you knew, or even canceled. And here's an example of a colon cancer situation. So colon cancer is the second deadliest cancer worldwide. It also is very preventable, yet, if we catch it in time. So because of the because of COVID, a lot of these screenings, in the form of colonoscopies were canceled and delayed and pushed out. But we have a solution here. It's something called PillCam. It's a capsule endoscopy that can be done at home to screen for polyps that may require treatment. And I'm excited to share that we, already have impacted thousands of patients globally with this technology. For example, in the UK, the National Health Service became overwhelmed, with, now that it's restrictions from COVID are lifting. They have this massive waiting list for colon cancer screenings for colonoscopies. Hundreds of thousands of colonoscopies have been canceled. So they were concerned about these patients presenting themselves later with cancer. So PillCam gave them an option to visualize the colon without the risk of infection or going to the hospital. In this case, the PillCam is shipped to a patient's home. We partnered with Amazon, and the patient can take this capsule at home, ingest the capsule. The video images of their colon are beamed to their phone, and you can't see it on your phone though. And then into the cloud where we run AI against the video and alert the physician about the outcome of that virtual colonoscopy. And 7 out of 10 patients, typically don't have an issue and don't need to go in the hospital. The other 3 out of 10 would need to go in and get a polyp, removed. So this created a lot of capacity for the national, for NHS in the UK. And we're really excited about this. And this is a technology we'll be globalizing. Going to the next page here, another example, which is more a Canadian example. I don't want to overlook Canada, where we've used the power of innovation and collaboration to alleviate challenges magnified during the pandemic. So as you know, Canada has half the number of ICU beds per capita as the United States. I didn't really know that coming into the pandemic. It was Neil has since educated me. And this issue, coupled with travel restrictions across the country, put an enormous strain on healthcare systems across the country. So leveraging technology to overcome some of these challenges was critical. Medtronic Canada partnered with the Jewish General Hospital in Montreal, along with the Augur Group Council, to pioneer the first application of Microsoft HoloLens for use in real-time extended reality, clinical support for minimally invasive procedures. In this case, to replace a heart valve. So there's another, great example. If you go to the next page here, I know I'm running short on time. Here's another example as part of our initiative to provide, some more remote capabilities. Medtronic proposed deployment of what we call our CareLink Express mobile platform for the Ottawa Heart Institute. The Ottawa Heart Institute now remotely follows more than 50 patients with Medtronic implanted devices as part of this program. And these patients are in a remote area, which I don't know if I'm pronouncing it right. I've been to a lot of places in Canada, especially growing up as a hockey player, but I've never been to Iqaluit, I think is how you say it. I'm not quite sure, but that's where these patients are, and we're now remotely monitoring them, and it prevents those patients from having to come to Ottawa, or the Ottawa physicians having to go visit these patients. And this is the first CareLink Express mobile clinic. It took place here 2 months ago in August of 2021, and it's been very well received. So these are some of the examples in Canada. So if you go to the next page, just kind of summarize some lessons learned during the pandemic. As I reflect back over the last 18 months, just the other day, I was just thinking about this when we put this kind of slide together. There are a number of lessons learned, which I think are going to have far-reaching impact. First of all, what we're calling remote everything. Prior to the pandemic, people were very tentative to adopt remote approaches to healthcare, even though a lot of the technology was there. But because of the pandemic, many quickly embraced this. Everything that was offered remotely: patient visits, device checks, patient management, physician training, like we just shot with the HoloLens, connections with coworkers, and the list goes on. So I think this is here to stay, and we're not going back to the way we did it before. And I say we, I mean the collective. I was just at a U.S. hospital earlier in the week that does a lot of bariatric surgery, and they told me they're getting rid of the bricks and mortar that they have reserved for patient visits in all the work leading up to the surgery, and they're now doing this all 100% virtually. So I think this is the remote everything for all these different interactions with many interactions with patients, not all but many. Physician training, monitoring of patients, monitoring and reprogramming of implantable devices, all can be done remotely. Another lesson learned is just the collaboration and the partnerships. When our backs were against the wall, we got very creative with partners, moved quickly. We didn't, usually, we spent a lot of time with contracts and things like that. And then you get to the work, we just started with the work and did the contracts in parallel, and we moved, much faster, is one example. We had a lot of unique partnerships, and it really contributed to our innovation, our thinking, and our results. I mentioned Intel, SpaceX. It was just a really, the last 18 months is a really great experience collaborating with all sorts of organizations, including governments. And this will continue to be an essential part of, how Medtronic moves forward. And I think many in our industry as well. And then finally, just technology. Like I said, I started the discussion off on, there's so much innovation going on in technology. And I really do think it's the path forward here for for healthcare. More than ever, patients, healthcare officials, physicians, hospitals aren't willing to make trade-offs between, the three, what we call universal healthcare needs of improved patient outcomes, improved access for patients of all type of patients, including those in low resource environments or disadvantaged cohorts of people, and lowering the cost. And we've seen that just, asking people to work harder and work longer, or, it's burning people out, and where there's a real resource constraint on, you can't just hire more people. There are constraints on healthcare workers out there. The only path forward, I believe, is technology to solve these three challenges without making trade-offs. And we're at a time where technology innovation is really accelerated, and there's lots of great applications in healthcare. We talked about, data and AI is having a profound impact on what we're doing here, for one example. And I would also, I'm seeing governments around the world. I was just in Europe last week, really shifting their thoughts on investing in healthcare as thinking of healthcare not as an expense, a necessary expense, but more as a strategic investment. And there's lots of studies out there that show $1 invested in better health, it equates to anywhere from $2 to $4 of economic benefit. So, healthcare can be an economic driver as well. And I think as all this technology presents itself in the healthcare system, I do think in parallel to introducing this to the healthcare system, we have to continue to move more to value-based models. And I know my predecessor, Omar Ishrak, spoke to you a few years ago about value-based care. This is still a really important element of our strategy. And I know Canada is a health system is embracing this as well. And I know it's forefront of many of your minds. This is something that we remain committed to as well. So lots of great innovation, but the payment models have to be tied to value. And I'm confident that this innovation will deliver that value. So, in closing, I'd just like to say I really do believe there is a silver lining here from the pandemic. It's this crisis has forced us to be more creative. It's accelerated the adoption of technology traditionally reserved outside of med tech and healthcare, and bring it into healthcare. And it's created a lot of better outcomes for patients and healthcare workers, for that matter. And then the partnerships, the more collaborative approach that we took, between industry and governments and hospitals and physicians through the pandemic, I hope will continue as we move forward, because even though there was a crisis looming, it did feel good to work in that way, in that shape. And so I hope that will continue. So at this point, I want to turn it back to Sarah and invite Neil to join me so we can move on with some Q&A here. And thanks for the opportunity to speak to you today.
And thanks for that, Jeff. There's lots I know to explore from our audience, and I have a few questions to get us kick-started. But Jeff, you mentioned this briefly, but you were captain of the Penn State men's hockey team and later inducted into its Hockey Hall of Fame. Just wondering who your favorite Canadian hockey player is and who your favorite Canadian hockey team is.
Well, the team is a tough one, but my favorite player by far is Mario Lemieux. I mean, I know he played for the Pittsburgh Penguins where I grew up, but he was by far, to watch him play, he could do things that no one else can do. I know Gretzky's still the greatest, but if I could pick one player to watch because of his physical gifts, his size, his grace, it would be Mario Lemieux.
Great.
And I don't know on my favorite Canadian team. I still remember as a little kid in Pittsburgh when the Montreal Canadiens came to town, and they had all the red away uniforms, and I'd never seen anything so bright on the ice. And plus, I was in awe because they were fresh off of whatever at that time in the 80s, they already had 20-some Stanley Cups, and so I was in awe of them. I'll say that. I don't know if they're my favorite, but I definitely in awe of them.
That's great. Thanks. So I know Medtronic has won a lot of awards for diversity and inclusion, both Canada and globally. Why is this so important for your organization? And what's the basis of the strategy? So maybe we as healthcare organizations can learn a bit from your experience.
Well, I mean, like why it's important is look, we're for a couple of reasons. When you have a company as big as ours, but you don't need to be big and as complex as ours, you know, the decisions we're making are often complicated and not clear cut. I mean, same, I think like a hospital or a government official has to make, these are complicated decisions, and you need people around the table making those decisions that look at it different ways and have diversity of thought and diversity of background. And I'm a big believer that this is makes organizations better when you have diversity of thought, diversity of background, and so you know, ethnic diversity, gender diversity, that doesn't guarantee you diversity of thought, diversity of background, but they are highly correlated. They are leading indicators, and so you know, we think it makes us a better company. That's one reason. The other is that our employees, it's important for them. We're a tech company, and we're in competition for all talent, especially technology talent. And you know, they want to work more and more these days with a company that's aligned to their values. And our the type of employees that we aspire to have at our company, and this matters to them. They want to work in a diverse environment, and it's important to them. And so, and our customers as well, as we go out and talk to customers, you know, they want to see a diverse Medtronic show up, and a Medtronic that reflects the diversity of their patients and their physicians. And so that's why it's important. I'd say a key to this, though, it has to be authentic. You can't be doing this because it's politically correct. It's you that won't work. I think you really need to have an authentic commitment to this, and understanding why it's important. And so we have had a lot of dialogue with that over the years, and I can tell you it is authentic commitment at Medtronic, and we've made a lot of progress. You pointed out some of these awards, but more important than those awards, you know, our employees, they say it feels right.
That's great. And Neil, I'll count on you to jump in to provide any Canadian context or experiences on any of these questions.
Yeah. Well, I think, you know, it's been a very natural progression for us. You know, 50% of our leadership team is you know, women, and it's just a natural thing because they're great leaders, and they provide great perspectives and challenge us to look at things differently. But we also, our head office is in Brampton, which is a very, very diverse place. And we want to reflect the communities that we serve. And so it's been natural as we hire employees that they're very diverse. We're very proud of all the awards that we've accumulated in the last year, particularly more than 10 awards. I think Jeff gets tired of all the stock wire reports from Canada. But we're going to.
No, I don't, Neil. Keep it coming. It's good.
Great. Thanks. I loved your story about the ventilators and what you did in the pandemic. But I think the thing that keeps most healthcare leaders up at night is the shortage now of healthcare workers. It's likely to persist for a while. Do you see anything in your own pipelines or your own approach to innovation that will help us get through what are predicted to be acute shortages of, for sure, nurses, for instance, and other allied health professionals, and maybe even doctors over the next 5 to 10 years?
Do you want to take this one, Neil? You want to start?
Sure, I could start. You know, we can't solve the whole problem, of course, but we do have some important suggestions, and one of them, you know, starts with looking at the way we do surgery. You know, there are, I'm sure you're aware, Sarah, from your hospital, there are a number of minimally invasive approaches to surgery, and that allows a small incision, less bleeding and infection, and ultimately a lower hospital stay and a speedier recovery. And we, as Jeff outlined, we serve a very broad array of conditions and surgeries. And, so we would posit that a greater commitment to minimally invasive surgery in Canada, where it's still very much underutilized, will help to alleviate some of the pressure on hospital beds and on nurse staffing. Another thing Jeff talked about is remote or virtual care, which I think is already having a very positive impact. A good example in Canada that we use a lot is the remote access to patients with devices, whether pacemakers, defibrillators, wearable insulin pumps, that allows the healthcare professional direct access to the patient's data and can often obviate a routine visit to the hospital. Jeff hasn't talked yet about this, but we would foresee over the next decade a real revolution in the use of robotic surgical assistant, we're in the process of launching 3 platforms right now, while that doesn't replace the surgeon, it may reduce the need for assistance in some cases, ultimately. It will allow more minimally invasive approaches, we really are aiming to demonstrate better value, as Jeff also emphasized. Jeff?
I think you got the 3 things. I mean, the miniaturization of technology allows for less invasive. So, like our pacemaker now, one of our pacemakers is the size of a paperclip, and it's implanted with a catheter versus a surgical procedure, and that the much lower complications, shorter hospital stay. We're replacing heart valves now, with catheters, and so this miniaturization and less invasive approaches is here. It's now, and it'll continue to. We'll continue to do this, miniaturize our products and in less invasive ways to utilize those. He mentioned robotic surgery. So in whether it be orthopedic surgery or soft tissue like general surgery, even cranial surgery, we're finding that the incisions are much smaller. The cut to close time is much less, and hospitals, the length of stay is shorter, complications are less, and this is going to be a trend that's going to play out over the next couple of 10, 20 years. And then the third, which is and so those are well on their way. The third one, which is something that we're working on, is more in development, is more remote monitoring of patients with sensitive and specific data. So many healthcare systems that I talk to say, look, help us with building a bridge. We got patients that we can somewhat come in with their Apple Watch and their Apple Watch data. We don't know what to do with this. And it's hard to make clinical decisions from this. That could be part of the puzzle, but we need more sensitive and specific data. And something that's always on, if you will. We've got sensors that could be placed on the skin or just under the skin. And we do clinical work that would allow physicians to make clinical decisions off this to avoid unnecessary hospitalizations, to avoid unnecessary escalation of issues, and then route those patients to the right place at the right time. This is something that there's a lot of work to be done on. It's not here and now yet, but we're moving in that direction.
Great, comprehensive answers. I don't know if anybody's going to put any in the Q&A. I have a lot to try to get through, so we're okay even if none come forward. But, we've all sat around a lot during this pandemic. Many of us put on 20 or more pounds or had too many glasses of wine. It sounds like many and now have an exhausted workforce. And so I think many of your innovations will help us deal with the physical illnesses that we had before and maybe that have been exacerbated. The next pandemic, though, is the mental health one. And this will have impacted us already in a world where there was already a lot of pre-existing mental health conditions. Just wondering, is this an area that Medtronic is getting into, or any thoughts about the future of mental health diagnosis or treatments in your own approaches to business?
Maybe I'll start and ask Jeff to follow. But, I think one thing during the pandemic that's been tough on mental health is all the patients that haven't had access to care. I think that's been very challenging. Now, while we're not a mental health company specifically, we do work a lot in neurosurgery on specific chronic conditions. For example, chronic neuropathic pain, and also the related opioid addiction issues. We do have technologies that address that very effectively, which are underutilized in Canada. We talked about minimally invasive procedures, which I think that also helps patients with mental health if they get out of the hospital faster and return to productive lives. And also, we haven't talked that much about the administrative burden, but we do have teams that assist with the administrative burden and getting patients, to flow through the hospital more quickly. So these are maybe peripheral things, Sarah, but certainly during the pandemic, we've worked very closely with our employees, with the Canadian, Mental Health Association. And I think just better communications, more frequent communications, use of things like humor, and just showing more TLC for our employees has been really, really important for mental health, during the pandemic. Jeff?
Yeah, look, I think you covered it. I think from a therapeutic perspective, Neil talked about we're on the periphery of this at best. And what we're doing is just like many of the folks on the call here, and yourself, you lead an organization with lots of different employees, some of which have, haven't been able to stay at home during the pandemic and have been on the front lines, and some of your administrative people may have been more remote, but and just working with providing extra benefits for our employees and stepping up the communication with them and training our managers on mental health and issues and being sensitive and aware, and so really just working with our own employees has been the biggest thing we've done. But I agree, I am concerned about this. We hear about it all the time. Our employee surveys that we do, every 6 months, and we've been doing it more frequently during the pandemic, it indicates that people are stressed, and it is a concern.
Thanks for that. I haven't seen Matt's face, so maybe I can get one more question in, which is a really important one. Jeff, you're just back from Europe. You've thought a lot about the rapid adoption of innovation post-COVID. As Winston Churchill famously said, you should never let a good crisis go to waste. What can Canada do to leverage the learnings from the pandemic and more rapidly adopt innovation?
Well, I think, like I was in Italy in advance of the G20 that they're hosting as part of what they call the B20, the Business 20, creating, working with colleagues across the life sciences industry to recommend policies to the G20 governments for, the life sciences industry and healthcare. And a constant theme is, you don't waste this crisis. There's, you've got healthcare is front of everybody's mind. And everybody, if they didn't already know, they're reminded of the importance of healthcare to society and to the economics of society as well, but also the role of technology. I mean, the vaccine was a miracle, and I know there's some controversy around it, but my opinion is it's been a miracle and has allowed us to, it will allow us to get back to normal life, and we're heading in that direction. And so that's technology, but and so people are really keen on the adoption of technology to solve some of these problems. And so, and governments are doing stimulus packages and things like that. And healthcare is part of many of them. And the adoption of technology is part of it. And so I think we've got to take advantage of this time to accelerate the adoption of technology in responsible ways. That's why I think the value-based models would be, adopting it with value-based models would be ideal. I know that's a lot, though, new technology and value-based models at the same time, but I do think that would be the ideal. And that was really the message that we were getting across the governments. And quite frankly, the governments of the G20 were very excited about this and more open to healthcare as a strategic investment versus kind of healthcare as like a kind of a necessary cost. And there's a big difference there. And the link between health and wealth and the importance of technology. So we are really working with governments to show them this and give them these examples of like the pill cam I just talked about for colonoscopies and the impact of robotic surgery and minimally invasive of, our tiny pacemaker and how that works, remote technologies and all of these things and the impact they're having. And then governments are saying, okay, we want more of this. How do we adopt this? And they're entering much more collaborative conversations with us. And so when I say us, I mean industry. So I think I would encourage everybody here to join that in your own way, join that dialogue and move quickly here.
Thanks.